Welcome to Healthy Food Action's Healthy Food, Healthy Farms webinar series. Today's webinar, Visualizing Health and the Farm Bill, is a collaboration between the Institute for Agriculture and Trade Policy, the American Public Health Association, and the Johns Hopkins Center for a Livable Future. I'm Becca Klein with the Center for a Livable Future, and I will serve as moderator for the webinar. We will be addressing questions from the audience today after our three panelists have finished their presentations. You can submit your questions to us at any time during the webinar by using the question panel on your screen. Just type in your question and hit send. We will review questions as they come in, and the panelists will respond to as many questions as time allows. Today we are joined by Jennifer Billig, Roni Neff, and Beth Hoffman. Jennifer Billig is the Senior Program Leader for the Food and Health Team at the Institute for Agriculture and Trade Policy and leads Healthy Food Action, an initiative to engage health professionals across the U.S. in creating healthier food and farm policy. Prior to joining IATP, Jennifer spent 15 years working with local, state, and federal government organizations on policy, outreach, organizational development, and communications. She's led transformational change efforts inside organizations, managed several campaigns, and worked as a vegetarian cook. Dr. Roni Neff is Director of Research and Policy at the Johns Hopkins Center for a Livable Future, and is on faculty at the Bloomberg School of Public Health in the departments of Environmental Health Sciences and Health Policy and Management. She performs research and analysis on issues including public health and agriculture policy and food system ecological issues. She also manages the center's policy and research programs, works with students, and teaches. She has been active on Farm Bill issues and previously co-led the American Public Health Association's Food and Environment Working Group. More broadly, she has worked in public health research, policy, and practice for over 20 years. In her spare time, she is an avid gardener and composter. Beth Hoffman is the managing editor at Food+Tech Connect. She studied the food system in depth as a fellow and co-lecturer in the Africa Reporting Project at UC Berkeley School of Journalism, and has reported on food and agriculture for 10 years, airing on NPR, The World, Latino USA, Living on Earth, KUER, and KALW. Hoffman completed a year-long documentary project, Cooking with Immigrant Women in Their Homes, has reported on rice production and chicken farming in India, Uganda, and Ethiopia, and did a multi-part series for KUER on our artistic, cultural, and environmental connections to food. Hoffman married into an Iowa family farm and is currently working with her husband to slowly convert the land into a sustainable orchard and hog farm. Her previous work can be found on the website at bethaudio.com. Before we begin, I just want to remind you again that you can submit your questions anytime during the webinar by typing your question into the panel on your screen where it says, "Enter question for staff," and then hitting send. Now I will turn things over to our first presenter, Jennifer Billig of the Institute for Agriculture and Trade Policy. Jennifer?
Thanks, Becca. So I'm going to start by giving an overview of the Farm Bill and its intersections with health. And I'm sure many of you probably know that the Farm Bill is not traditionally discussed in terms of health, but the policies contained within it significantly shape the American food environment in which individual choices are made. The Farm Bill influences what gets grown, what it costs, how it's marketed and sold, and what kind of access people have to the food supply. The Farm Bill, this new Farm Bill cycle, which is up for reauthorization, really started last year and was supposed to be done as part of the super committee process. But as everyone knows, that process fell apart. The super committee never came forward with a proposal. So the Farm Bill did not get done as part of that, and now everyone expects that it's going to get done between now and Memorial Day. And what we're hearing is that if it doesn't get done between now and Memorial Day, it likely wouldn't happen until after the presidential election. So the upshot is that there's still plenty of time for the health community to weigh in and have a very real impact on this next Farm Bill. So the Farm Bill is divided into sections known as titles. And the list of titles usually changes a little bit in every Farm Bill reauthorization process, which is done about every 5 years. In the 2008 Farm Bill, there were 15 titles, which you see listed here. And today I'm going to walk through a number of these titles and talk about where they intersect with health. In 2008, $300 billion were allocated through the federal Farm Bill, at least originally, and I'll talk a little bit about that. And that $300 billion allocation is for 5 years. This next chart shows the percentage of total 2008 Farm Bill dollars allocated by title. And at least when the Farm Bill was first authorized in 2008, 68% of the dollars in the Farm Bill were going to the nutrition title, which primarily is for the SNAP program. The share dedicated to SNAP dollars is now even higher as more people have enrolled in SNAP during the recession. So SNAP is in the first title of the Farm Bill, which is called Nutrition. And in 2011, the federal government spent about $78 billion on SNAP. 75% of those enrolled in SNAP are families with children, and 92% of the dollars in SNAP go directly to families for food purchases, meaning that only 8% is for administrative costs. And every dollar increase in SNAP benefits generates $1.72 in economic activity. And the Congressional Budget Office has rated an increase in SNAP benefits as one of the 2 most cost-effective of all spending and tax options it examined for boosting growth and jobs in a weak economy. So it is a stimulus program. Despite that, everyone fully expects that SNAP benefits will once again come under attack in this next Farm Bill cycle, and that the health community would have to unite with others in order to protect those dollars. So this graphic is a picture of the White House garden. And now I'm going to start talking about the rest of the Farm Bill. So we talked about the nutrition title. Now I'm going to talk about the other titles. And this graphic represents what is currently grown in the White House garden in terms of the vegetables planted. And here is what the White House garden would look like if it were planted relative to the kinds of crops subsidized by taxpayers through the Farm Bill. So again, it doesn't include the nutrition title. So from a health perspective, what we'd like to see is more public dollars being allocated to the kinds of crops and programs and farming practices that support human and environmental health. So much of the public debate around the Farm Bill has in recent cycles been focused on the commodity title. It seems very likely that one of the major farm subsidy programs in the commodity title will be eliminated in this next Farm Bill cycle, and that program is known as direct payments. And that more of the support for farmers will be shifted to crop insurance, and I'll talk more about crop insurance in a minute. Direct payments are the only form of subsidy, or not the only form of subsidy in the commodity title. There are others, such as counter-cyclical payments, and there are other subsidies in other titles. There's a common perception in the health community that the subsidy programs in this title of the Farm Bill have created widely available, cheap, high-fructose corn syrup that in turn gets used in many cheap, nutrient-poor processed foods, which contribute to the epidemic diet-related diseases. And while it's true that high-fructose corn syrup is a widely available, cheap input that's used in processed foods, subsidy programs have not been the primary cause. High-fructose corn syrup proliferated in the 1970s, starting in the 70s, after the development of a low-cost method of using enzymes to convert cornstarch to fructose. And the overproduction of corn started in earnest after the 1996 Farm Bill, which removed most of the controls over how much farmers could grow. So their incentive has been to grow as much as possible to maximize their income. We partnered in December with Food and Water Watch and the Public Health Institute of California to do an excellent webinar on this topic, and I encourage you to take a look at it on our website at healthyfoodaction.org. So crop insurance is very important to farmers, and at the time of the 2008 Farm Bill, it was the third largest title, and I've heard from some that the dollars have now increased so that it's actually the second largest title in the Farm Bill. Getting insurance is a major issue for farmers of fruits and vegetables. In some cases, there are no policies available, and where policies are available, they do not provide adequate coverage in the case of disaster, as the reimbursements are typically based on wholesale commodity crop prices. So an example would be that if you have a farmer growing organic heirloom tomatoes for which they can get a higher value at farmers markets or through a CSA or when they sell it to local grocers, if that crop was destroyed by a tornado, the farmer would only be reimbursed for a traditional tomato, which would be much cheaper to grow. So they would be losing a lot of money through the crop insurance reimbursements, and it wouldn't even be covering the cost of their inputs. So this is a huge problem, particularly for fruit and vegetable growers, and we need better insurance for farmers of fruit and vegetables. Because this lack of insurance for these kinds of growers significantly increases the farmer's financial risk. Which leads us to credit and the credit title. The issues of insurance and credit are closely intertwined because the granting of credit is also based on risk, and the lack of crop insurance makes growers of fruits and vegetables higher credit risks in the minds of lenders. And typically, as the size of a farming operation grows, more access to credit is needed in order, for example, to fund the inputs for each planting season. So fruit and vegetable growers often face a glass ceiling in terms of how large they can get because of the difficulty getting credit, because of their difficulty getting crop insurance. And this limits their ability to respond to increased demand generated by farm-to-school or farm-to-hospital programs, as one example. Next, I want to talk about conservation. I think everyone knows that healthy food is grown in healthy soil, healthy water, and clean air. And some Farm Bill conservation programs do support farmers who grow without pesticides, who conserve wetlands, and minimize water pollution. Unfortunately, these programs have already been targets of cuts by both the Obama administration and Congress, and it's very important that we fight to support these programs in the next Farm Bill authorization cycle if we want to preserve the growing of healthy, toxic-free food. An often overlooked title of the Farm Bill is the research title. The majority of funding for agriculture-related research is allocated through the Farm Bill. This chart shows how public agriculture research dollars are currently allocated. It's important because today's research strongly influences future farming production and practices. And today's agriculture, the way we practice agriculture today, reflects several decades of investment dominated by research into large-scale, chemically intensive production of mostly commodity crops. So another area that we need to focus on is fighting for more of the public research dollars allocated to support healthier, more sustainable production in the U.S. The Healthy Urban Food Enterprise Development Center was also funded in the 2008 Farm Bill to promote innovative entrepreneurial approaches to making healthy foods more accessible to those who are poorest in the United States. And the grants made through the center benefit both producers and consumers and bridge the gap between urban and rural areas to support regional economies and to provide employment opportunities. The center received a $900,000 allocation of one-time funding in the 2008 Farm Bill, which is just so small. And so in order for the center to continue and for its programs to continue serving the poorest Americans, it would have to be reauthorized in this next Farm Bill cycle. While it's not related to a specific title, I wanted to say a word about social justice in the Farm Bill. Some of you might have heard about the Pigford settlement, where the USDA was sued in a class action suit by black farmers for discrimination in receiving loans and support for many of the programs contained in the Farm Bill. The USDA is currently working to provide redress to these farmers after Congress dragged its feet about appropriating the funding needed to settle the lawsuit. The Pigford settlement looks primarily at discrimination in commodity and credit title programs, but it's worth asking the question about whether the equitable distribution of resources through other farm programs whether or not the resources in other farm programs are equitably distributed, as well as practices that might have been discriminatory towards Native American farmers, Latino farmers, and women farmers. And in many cases, the USDA does not collect racial or ethnic data about who receives support under these other programs. Programs that support local and regional food systems are found in several titles in the Farm Bill, including some we've already covered. There are programs that support farmers markets and the use of SNAP EBT at farmers markets, programs that help farmers grow and market fruits and vegetables, and programs like DoD Fresh, which provides many school districts with affordable access to fruits and vegetables. These programs, as well as others, have been brought together in a new marker bill known as the Local Farms, Food, and Jobs Act. Asking your members of Congress to support the inclusion of this marker bill in the new Farm Bill package is something you can do right now to help create a healthier Farm Bill. If members of Congress are contacted by health professionals from every congressional district in America about this bill, it could definitely have a major impact. We've tried to make it easy for you to take action on this bill and contact your senator and representative at healthyfoodaction.org. If you visit our homepage, you'll see it there on the left side. And you can also sign on to the Charter for a Healthy Farm Bill and join luminaries like Dr. Walter Willett, Andrew Weil, and Kelly Brownell in signing the Charter for a Healthy Farm Bill. So with that, I will turn it over to Roni Neff.
Good afternoon. I'm happy to have the opportunity to talk with all of you all around the country about the Farm Bill, which is one of my favorite topics. And I also want to remind you and encourage you to submit questions through the webinar interface. So Jennifer's presentation provided a great overview of the Farm Bill and what's in it that's relevant for public health. In my piece of the webinar, I'm going to show you a different and visual way to wrap your head around what's in the Farm Bill through an easy-to-use online tool called the Farm Bill Budget Visualizer. And I'm here from the Center for a Livable Future at the Johns Hopkins Bloomberg School of Public Health. We are an academic center that focuses on the connections between diet, food production, environment, and public health. And I'd encourage you to check out our website. There's a lot of really useful resources there. So because of these issues that we focus on, we're quite concerned about the Farm Bill, and we're engaged in multiple efforts to bring a public health voice to this policy. And we know that a lot of people within the public health community would like to get engaged, but they feel like the Farm Bill is this kind of black box. They're confused or overwhelmed by it. And this graphic is, in some sense, a great representation of that. I would also note that this is actually a pretty useful graphic if you take the time to look through it. But regardless, it's complex. And so we prefer to sometimes make things simple because it's really helpful in terms of getting engaged. And so here's a 5-point summary of why the Farm Bill is a public health bill. It affects what we eat, environmental health and sustainability, food security, equity, and rural public health. And so we were thinking about how do we take this kind of information and make it usable and easy for people to understand. And food system advocate Margie Roswell, in the lead up to the last Farm Bill, had developed this prototype Farm Bill tree map. And a tree map basically, this is the graphic from it, sizes each of these boxes based on the relative size of the budget. So it's a way to see how all these, the relative sizes of these important pieces of the Farm Bill, and to see how they kind of fit together. And this is actually the USDA budget. It's not the Farm Bill directly. And we said we could maybe take this for the next Farm Bill and really build on it, take it to the next level. So we thought we'll just get the Farm Bill budget and we'll put it into the software, and voila, we'll have the Farm Bill Budget Visualizer. And it turned out that there actually is no Farm Bill budget that you can get access to. In fact, USDA and Congressional Research Service also told us that they didn't have a detailed budget So what we did is we did the painstaking process of going back to the original Farm Bill 16-page table of contents, and we took each item there and compared it with the USDA budget as well as budgets of other related agencies. There's a few pieces in the Farm Bill that affect other agencies to create a new database that we could use, and we've made the database available also for those who might like to do analyses in the future, because we think this kind of making the data available is really an important piece of building engagement. So one of the things, another thing that we did in the visualizer, and this is thanks to as well to research assistants Desmond Flagg, Linnea Lestadius, and also Becca played a role in this, is we went through every item in the Farm Bill and we coded it according to this list of topics so that you could really see how the Farm Bill is going to play out in terms of all of these themes that are of interest to public health and related communities. And just to give you a sense of the Farm Bill budget in the broader context, here's the entire United States 2011 budget. And the Farm Bill is less than, actually the USDA budget is less than 4% of the United States budget. So that just gives you a sense of how this all fits in. And this tree map was made by the Hive Group, which is the group that we worked with to develop the Farm Bill budget visualizer. So at this point, I'm going to shift over to the actual visualizer itself. And here is the home page for the visualizer. And when you click on that, you will get to the actual visualizer. And I'm told that it might be a little slow because there's a lot of you on here, so we'll switch to screenshots if we need to. So here is the entire Farm Bill laid out. This is the initial view that you will see. And what you can see from looking at this, you can see the broad contours of the Farm Bill. You can see that the Supplemental Nutrition Assistance Program, or SNAP, formerly food stamps, it's about 2/3 of the Farm Bill budget. And you can also see, if you mouse over, for every program, you can get a little information about it. You can get some historical budget information. You can see how we coded it according to all those topics. And then if you click on that space, you can click on Find Out More About This Program, and you could link, for example, to a USDA website about it. So the other thing that you can see from looking at this is you can see the general contours. You can see what are the biggest programs in the Farm Bill. So you can see that in addition to SNAP, we have the Crop Insurance Fund, export credit guarantees, and direct payments, which is what is often thought of as subsidies, are some of the bigger programs in the Farm Bill. And so just to go over, each of these boxes is sized based on their budget amount. And then in this particular view, the darkness of the color also relates to their budget amounts, but I'll show you other ways to view it. So probably many people get engaged in the, are thinking about, so where do the topics that I'm interested in play out in terms of the Farm Bill? And so there's two ways to look at that. And the first one is in this color represents section. And I'm going to do this, and I'm going to go down to the program's relation to public health. And we have every item in the Farm Bill coded. The lightest green, like what you see here on the Food for Peace, for example, or some of these other ones, are the ones that have the primary relationship to public health. There may be public health somewhere very directly in the mission of that program. Secondary is plays a role, but it's less related. Partly is there may be some less, again, much less direct connection. And then no is in gray, where there's not really a connection. And you can see that a lot of the items in the Farm Bill actually do have some connection to public health, albeit relatively, the main things that you see are secondary and tertiary relationships. And because the SNAP program occupies such a significant portion of the screen, we actually put in a button that allows you to temporarily hide the SNAP program to see more budget items. And I'm going to click that now. When you do this, you have to just keep on like a mantra reminding yourself, and SNAP, because as Jennifer was discussing, the SNAP is a really critical program within the Farm Bill and for public health. So here's the key public health programs with SNAP hidden. And you may want to see, the other way to see these items by topic is to go to, I'm going to go back to this 2011 spending, and then I'm going to show programs related to public health through these radio buttons here. And so I'm going to click on primary and secondary. So now we can see what are some of these programs that have a relationship to public health, and we can read their names. And one of the things that we find out is that when we look at this list, a lot of the ones that come up here are not the main things that we would think of as having a connection to public health. And so we may want to limit the budget. And so I'm going to go to General Filters, and I'm going to limit it by the size of the 2011 spending. So we start with $70 billion here. That's the SNAP program. And I'm going to come all the way down to, let's say, around 20 million. And now we can see a lot of the programs that are the main ones that you would think about when you think about public health. And you can take a look at what some of those are. So I'm going to get out of that, and I'll just show you a couple of the other issues just so you can get a sense of what some of these others look like. So, okay, I'm going to undo the primary and the secondary relationship to public health, but I've still got SNAP hidden for the time being. So let's look at fruits and vegetables in the Farm Bill. Once again, you can see that there are a lot of programs, but not a lot that have a primary relationship to fruits and vegetables. And then you might want to look at, oh, okay, wait, I'm looking at the screen over there, and I see that it's moving a little more slowly than I am, so I will slow down and wait for it to go. One of the things that you're going to see when you get to the fruits and vegetables section is that section 32 is up there coded as primary. This is where the Fresh Fruit and Vegetable Snack Program is funded through. So that's why it's coded as primary, because that's an important public health program. At the same time, section 32 funds a lot of other things as well. So, so you should understand that this coding, it's not exclusive, like that all the dollars in section 32 shouldn't be considered to be public health dollars, and that's true of all of this. You can't sum up these dollars and assume that an entire block belongs to this topic area. So here's fruits and vegetables. Let me show you access to fruits and vegetables. And you can see that there's a lot fewer items in the Farm Bill that have something to do with access to fruits and vegetables. Just looking at the grand scheme of it, it's a lot more gray on this field. Now let me switch from here. I'm going to show you what kind of funds in the Farm Bill are supporting commodity crops. And now you can see there's a lot more lit up in this map, and you can see that a lot of it is in the brighter color, showing a primary relationship. So so there's a lot in the Farm Bill that is supporting commodity crops, which is no surprise, of course. I think this also goes into some of what Jennifer was talking about earlier in terms of the fact that the commodity programs are, there's a lot of different commodity programs, so I'm going to zoom in on the commodity programs. Try to zoom in on the commodity programs. And you can see all the different types of programs that there are that support commodities within the Farm Bill through this. So that's another way you can look at it. And I'm going to click on the bar that says commodity programs up here, and I'm going to zoom back out. Okay, let me show you industrial food animal production. And the Farm Bill has pieces that support industrial food animal production, and it also has a lot of those commodity crops are also going to support animal feed grains. So here's industrial food animal production plus feed grains. And you can see that there's really a lot in Farm Bill that's supporting industrial food animal production, which is one of the types of food production that has some significant negative environmental consequences. And then I'll just compare that once again to fruits and vegetables. So you can see there's just a lot less in there on fruit than on industrial food animal production. Now let me turn, I want to be able to show you how you could look at for a specific program. So I'm going to show you community food projects. And this program, it basically increases food security in communities by bringing the whole food system together to assess strengths, establish linkages, create systems to improve self-reliance of community members over their food needs. So that's the kind of program public health could really get behind. And this is a small program within the Farm Bill. And I'm going to track this so you can see that. I'm going to turn it yellow. And then I'm going to go back out to the full extent of the Farm Bill. And oops, let's show the entire budget. And you can't even see it here. It's so small. Here it is down here in the very bottom corner. So let's hide SNAP. And now you can sort of see it. That's how small it is in the context of the Farm Bill. So if I want to take these filters and limit it by budget, I can move it in from 70 billion. I can show a smaller portion of it, like let's say less than $1 billion. And it's now you can sort of see it there in yellow, but it's still tiny. I can move down to, I don't know, 25 million, and now you're starting to see it. And if we move all the way down to 5 million, that's where we can really see it. So that just shows you some of these programs that we really could care about in public health and how relatively small they are in the context of the Farm Bill. But it's important to emphasize that small in the context of the Farm Bill isn't necessarily small in the context of impact. And this kind of money given out to small organizations throughout the country can actually mean a great deal for them and for their ability to take action. And it can also generate a lot of ideas and sort of initiatives that could be scaled up. So it can make a big difference, even a small pot of money. There are also a lot of items in the Farm Bill that don't cost anything and that aren't going to show up in this visualizer. But some of those also are valuable for public health. And in these times of tight budgets, we in public health need to be using as much creativity as we can to come up with impactful language changes that can be beneficial, because those are much going to be easier to pass. So let me step back out, and I just want to show you one more thing, which is that over the course of the upcoming Farm Bill, there's several other features in here that are going to be particularly useful. And one of them is the ability to show public health programs with endangered funding. Right now, these are items that have no baseline, which means that they would be discontinued in the upcoming Farm Bill without a strong effort to actually restart them. But we can also use this in the future to show other types of programs that are at risk. The other thing we could do, let me undo that. The other thing we can do is, did that come up on the screen? The other thing we can do is show spending change. So here is the 2012 versus 2011 change in spending. And this currently isn't so meaningful because there's a lot of different reasons going on here why all these programs change their amount of funding, relevant to the weather, relevant to poverty, and so on. But in the future, from one Farm Bill to another, this can be a very useful indicator, or from a proposal to another, this can be a very useful indicator. So I want to wrap up by just mentioning a few ways that the visualizer should not be used. And number one, we can't sum the dollar value of the programs for the reasons that I was explaining. Each of these programs may be coded in multiple ways. So you can't sum the dollar values of everything that says fruits and vegetables and assume that that's how much the Farm Bill is spending on fruits and vegetables. And again, as I was saying, you can't assume the programs in the visualizer represent the entire Farm Bill. So here is the home page for the Farm Bill Budget Visualizer. On here there are some like how to use, and there's a methods section. We've got one video up here, and we're going to have another one very shortly showing how to use it. And here are some resources for more information. Both and on our Farm Bill resources page, we have a number of publications and materials that could be of use. And the Center for a Livable Future has a public health and agriculture gateway that brings together all kinds of resources in the peer-reviewed literature and in the sort of gray literature on the Farm Bill and a large number of other topics. And so with that, I would encourage you to check it out yourself and to get engaged in the Farm Bill. We need all your voices. And I'm going to turn it over now to Beth Hoffman.
I hope we can see it. Okay, I'm Beth Hoffman. I work with Food+Tech Connect. And just a little background on who we are. I'm a journalist, first of all. I've done food and agricultural journalism for the last 10 years or so, and I joined Food+Tech Connect in August or September of this year. We're a media company that connects decision makers with the information technology and people they need to fuel food system innovation. So we do news and analysis, consulting, and events. And one of the events is what we're talking about today, the Farm Bill Hackathon. So everything you see here today, with the exception of one thing that I'll mention, can be found on our website. So it's just foodtechconnect.com. And I just want to remind people to send in questions as well. So we have some nice questions to answer at the end here. So I want to begin with just this. This is about the International Open Data Hackathon. This was what the Farm Bill Hackathon was part of. So it was an international day. And the idea was to use open source data to create tools. And if you were anything like I was, I didn't know what a hackathon was. What hacking, that sounds bad. That sounds like something that happens to your bank account that you don't want to happen. But the term these days is used by people in the tech world to, they get together and take usually open source data or information and try and solve problems. And so in this case, what we wanted to do is to take the Farm Bill, and this was an article that we wrote about it. What is the Farm Bill and why should I care? And we've noticed that if you can see that the likes on Facebook is very high here. We were kind of overwhelmed by what by the interest there was in what was going on with the Farm Bill. What is it? And this is kind of from the tech community is a lot of who's looking at this, but again we're at the intersection of food and technology. So so what we wanted to do was to take some of this information and make visuals. So the idea was that in the media, there's not a lot out there that people can use in order to discuss these issues. And we did this post, Farm Bill, blah blah blah. And the idea is that, as you see in this first line, the Food Conservation and Energy Act, also known as the Farm Bill, is one of the most daunting and boring documents that you never have to read. People don't read it. It's very hard to read, and it's extremely boring. But at the same time, as everyone has already pointed out, it's extremely important. And so how do we actually get people to care about it? And how in the food and tech community could we actually encourage people to be a part? So as part of that post, that Farm Bill, blah, 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 we looked at what visuals actually exist, the very few that were out there. This is what you just saw, the wonderful visualizer from Johns Hopkins. There is a video by the Environmental Working Group. This was at TEDx Manhattan by Ken Cook, and he explains in very plain language what the Farm Bill is, what's wrong with it, and maybe most importantly, what could be done to improve it. There were some other things we had on there. This is commodity cropism, is sort of an artful look at the crops that are supported by the Farm Bill pretty heavily. And commodities, so it actually looks at soy, sugar, and corn. There's 3 different ones. And then she kind of shows in the video that the products that all of these things are in. And then there is also from Parent Earth, the Parents Stand Up for Food campaign, which did a more lighthearted. It's not the budget visualizer, but it's kind of looks at the support for junk food and for commodities that end up being in junk food. We did not include this, but I think you all should know that this is a resource that's out there. This is from a group called Watershed Media, and this is a book written by Dan Imhoff called Food Fight. They're redoing the book right now, if it's not already out. But there's a ton of visuals here, and a lot of them are very health related and can show what's going on exactly with the Farm Bill. I'm not sure about the licensing for these, and so in order to copy them, you need to at least say where they came from. But everything that we produced is Creative Commons. Everybody can use the things that we created, and I will be showing you here. So this is the poster for the Farm Bill Hackathon. It happened on December 3rd. And these were our sponsors. And so what the idea was to take, again, open source data, so things that already exist, that are out there in the public domain, that are created by the USDA and other places, and to create resources that could be used in the media and with advocacy to explain the Farm Bill better. So on that day, we had 120 people sign up for it, and they were designers, programmers, food policy people, and a lot of people that were neither tech people nor food people, food policy people, people who like to eat. And they were both virtually online for it and in New York City on the day of. And there were 20 problems that were posted that I'll show you the page, that we developed a wiki that had all sorts of information and data on the Farm Bill that is still up and free for anyone to use. And so each of these groups, Hopkins, the Environmental Working Group, Food and Water Watch, Glenwood Grace Foundation, the USDA actually, Oxfam, they put up problems here, project ideas for the designers, and with them they posted the actual data that someone would need to design something illustrating these issues. And basically we stuck these 100 or so people in a room for 12 hours, and we had speakers, 8 different speakers on topics throughout the day, things that were much more tech geared, about big data, about visualization. And then we had a lot of speakers, including Rebecca Klein, who talked about the Farm Bill specifically. There was people from Why Hunger talked about the SNAP program. And out of this, we had 7 graphics and 4 tools that were designed during the day. So this is the wiki that, again, you can link to from our website, foodtechconnect.com. And you can find it on all of the, if you search Farm Bill, all of these articles will come up with all of this information, and it can get you to this wiki. And so all of these project ideas were listed, and this is an example of one, the corporate control of the meat case, who put it up, the actual problem, the connections to the Farm Bill, and then the data was listed and what kind of resources you could use. So one of the ideas that was listed by both Johns Hopkins and the Environmental Working Group dealt with fruits and vegetables versus commodities. And with the data that was there, they created this. This was actually the winning graphic from the event. They took the My Plate recommendations and they compared them to the actual budget spending on these within the Farm Bill. And so this is a shortened version. This again, you could link to from our website, but it's on SlideShare. If you looked up just the Clean Farm Bill of Health, you would find the whole set of slides. But here you can see that about $33.1 billion is spent on commodity crops. So this 1/2 of My Plate, which is grains, and then those grains fed to protein sources, livestock and whatnot, gets $33 billion of that budget. While the other half of the My Plate, the fruits and vegetables, which is supposed to make up half our diet, only gets $4.3 billion of public support. And this is specialty crops, which also includes nuts here, but this is, if you're looking for the terminology in the Farm Bill, that's specialty crop support. So it's 8 times, we give 8 times the support for 1/2 of the plate than the other. And according to the data, again, and this is all based on data, which I think is very important to point out, shifting 10% of those commodity subsidies into fruit and vegetable purchasing programs would pay for doubling the fruits and vegetables in U.S. school food programs. And it would actually meet the USDA school lunch guidelines. So this is another graphic that was created. This was created virtually. That is the same, talks about the same issue, but in a more specific way. It's talking about cotton versus, not specifically carrots, actually fruits and vegetables generally, but talking about the money that went to 8 California cotton farms just in 2009 was $8.5 million in subsidy payments. And if that specifically was redirected to the fresh fruit and vegetable program, which only had $5 million in 2009, with the $5 million, they had gotten fruits and vegetables to 144 elementary schools. And then if this cotton support was shifted to the fruit and vegetable program, we could have support for another 320 low-income schools. Not exactly sure about the time, but these, I'll just quickly show you these. These are about consolidation of the market, which again is on our website, that 4 companies control 86% of the beef market now. And this is a project that SourceMap, which is just sourcemap.com, they are going to be mapping all the major food crops, the production of them in the country. And so this is in hopes, so they started this with the Farm Bill Hackathon, and they are continuing this project in order to help people kind of trace where their food is coming and going. So the lessons learned here, which I think are applicable to all these communities that are interested in working with the Farm Bill, is first off, creating public engagement. We were completely surprised and overwhelmed at the fact that people, the majority of the people who showed up at the hackathon had no experience in either technology or food policy. And people want to be engaged, and they want to be engaged in meaningful ways in this discussion. And so they were willing to give 12 hours of their time on a Saturday to dig into data that we all think, no one would care about. It's too boring. People actually want to get in there, and they want to be involved. Secondly, the policy experts need to look at data in a new light. And I think we tend to think, again, that people are not interested in the actual data, but data tells the story, and it has to be what's driving the story, because it makes our arguments a whole lot stronger when it's based on actual fact. And you can look at the visualizer, for example, and see the actualities of what's going on. Thirdly, providing opportunities for those with different disciplines to interact. A lot of times we get very channeled into working with our own groups, but this is a very good opportunity to mix with people from different backgrounds and create something that's more unique than one of our groups alone would be able to do. And lastly, using the Farm Bill as a catalyst for envisioning solutions. So I think there's a lot of discussion about what's wrong with the Farm Bill, but we need to be talking about what we actually want to see. And I think that the graphics that were created were so strong because they actually talked about moving money from this program to that program and what would actually happen and the repercussions. I think that makes for very strong visuals and conversation as well. So again, here's where you can find the information, foodtechconnect.com. If you just searched Farm Bill, everything I just discussed with the exception of the food fight information from Watershed Media would all be available to you. And if you have questions, my email is just beth@foodtech.com. And with that, I will turn it back over to our question session and Becca.
Thank you, Beth, and thank you all for submitting your great questions. I'm going to start with a specific one that's directed at Dr. Roni Neff, but Beth, you may have some comments on this one as well, and I think it's a good segue from what you were just talking about bringing graphic designers and other media folks together with advocates and experts. Questioners commented that the visualizer tool would be important for legislators to learn to use and understand. Is there a way to formally present this to appropriate food bill committee members? And then another questioner asked, how do you foresee advocates using the visualizer?
Thank you. That was a great question. And I would say that in terms of presenting it to members of Congress or staffers, that could be a possibility that we would consider organizing a briefing to share this, as well as it could be shared during meetings, Hill visits, and that kind of thing as an educational tool. In terms of how advocates specifically could use it, I would highlight it, in particular, it could be useful for showing the relatively small size of some of the programs that we're talking about in terms of advocating with members of Congress and staffers. And then in terms of those same advocacy groups trying to educate their members, I think it's useful because they can show how the programs that they're talking about fit into the overall Farm Bill, and they can show both the relative size and do those kind of comparisons of, for example, fruits and vegetables versus commodity crops and that kind of thing, just show how Farm Bill funds are allocated so it can build people's motivation to get more engaged.
Thanks, Roni. So another question directed both to Jennifer and then Roni, if you have additional comments. Someone noted during Roni's presentation that Jennifer had commented that the subsidy program is not responsible for rising obesity rates and other diet-related diseases. Can she expound on that more? So she could be either of you here.
Yes, that is what I said. I think there is a strong myth in the health community as well as in other communities that the subsidy program has driven the production of high fructose corn syrup and hydrogenated vegetable oil. And it's just simply not true. The overproduction of corn and soybeans that resulted in the production of those crops is not tied to subsidies. It's tied to deregulation in agriculture, which actually happened before the subsidy programs as we know it. So the subsidies provide income support in different forms for farmers, but the trend towards overproducing corn and soybean and other commodity crops started before many of these subsidies were in place. It's true that the federal government is responsible for that because they removed the controls around how much people could grow, but it's not true that subsidies have created the problem. And as I mentioned in my remarks, we did a webinar on this topic last month in December, partnering with Food and Water Watch and the Public Health Institute, and it was really excellent. It goes into depth on this issue, and it also talks about a paper that was co-authored by those two organizations, which is available on the Food and Water Watch website. And so I urge you to take a look at that for more details. But it feels pretty important that we debunk this myth within the public health community, linking subsidies directly to obesity. It's certainly true that that high fructose corn syrup is one of the problematic elements in the obesity epidemic because it's used in soda and other processed foods. The piece that's not true is why we have high fructose corn syrup. It's not related to subsidies.
And I would just expand on that, first of all, to highly recommend that you check out that report because I think it's really beautifully done. But also if you look at the research literature, it's very surprising, but you actually cannot find any peer-reviewed empirical study that has supported the idea that, that these subsidies are contributing to obesity. And there are a number of studies that explain some of the reasons why that would not be so, which I probably don't have time to get into today, but we'll see if there is time. I could get into that. Additional reasons, I mean.
Thank you, Roni. So this is a rather juicy question with various political and policy leanings. So if SNAP, the Supplemental Nutrition Assistance Program, were a standalone bill in terms of getting that funded, would the other titles of the Farm Bill and public health programs get more support and funding? So that's an open question for the group here.
Well, I would just say that, my understanding, and Roni chime in here, about why SNAP was put into the Farm Bill in the first place is that SNAP was put into the Farm Bill to get urban legislators to support the Farm Bill, because a lot of the other programs in the Farm Bill are viewed as programs that support rural America, which isn't actually true, right? Because those programs support our food production. So it really is relevant to all of us, but traditionally that's how it's been perceived. So SNAP was put into the Farm Bill to get urban legislator support. So I don't know about separating it out. Again, I think it would require a broadened view among the public and among members of Congress about what the Farm Bill is really about.
I would add that I think it would be even more challenging to pass a Farm Bill without SNAP in it. And so I think that a lot of the other priorities would not necessarily get more support if we weren't able to get that Farm Bill passed, and if we didn't have the support of those who are really thinking about health and low-income people and stuff like that, really engaged in the Farm Bill, that could be detrimental. And I think that it's been historically beneficial to the food security advocates to be part of the Farm Bill, and it's been beneficial to the farm advocates to have the food security advocates there. So I think that there's so many political pressures that would make it very difficult to take SNAP out as well. But I think it's a really interesting question to really think about. If we took out all those pieces, what would it mean, and could there potentially be more money? And I think there's grounds for speculation on that, but those are some of the reasons why it might not.
Thank you, Roni. So one more question. Wouldn't crop insurance be related to public health, because the previous presenter, meaning Jennifer, this was asked during Roni's presentation, had stated that crop insurance dictates who can get insurance for which crops?
I would say yes, crop insurance is related to public health for exactly that reason. And it also is related in the sense that when you talk about sustainable producers, it's the fruit and vegetable producers and those producing in more sustainable ways and in more diverse farms that have more difficulty getting crop insurance. But crop insurance is critical for, it's really important to change the rules so we can get more crop insurance to those people, because that gives more people the feeling of security that they could potentially go into those types of to start up farms and that kind of thing, feeling that they're not as deeply at economic risk. So I would say that crop insurance is related to public health, and so I think that's a really good point. And that raises another issue, which I see that it's not coded as related to public health here. And with each of these codings, we actually went through, we had 2 to 3 coders for every single piece, and we went through, debated what the code should be. But a lot of this is very subjective, and as I'm talking through it, I feel like that particular one should probably be changed. I would really value it if any of you are looking through this and you see any things like that that make you say, huh, that you might suggest it to us so we can look at it, because we really want to make this the best document that it can be. So thank you.
And I would just say, this is Jennifer, I would just say that there is a crop insurance provision in the Local Food, Farm, and Jobs Act, so that is another reason to support it. It would help provide a bit better crop insurance for fruit and vegetable growers, so absolutely it's related to public health.
Thank you, Jennifer. I want to thank all 3 of our speakers for their time today and direct you to the Healthy Food Action homepage, where you can view recordings of past webinars and watch for information about upcoming webinars and actions. The next webinar is February 8th, and is about the impact of food dyes on children and possible policy interventions. It will be co-hosted by the American Nurses Association, and continuing education credits, CEU credits, will be available for nurses. You can also follow Healthy Food Action on Facebook and Twitter. And an additional way to get involved is via the Healthy Farms, Healthy People Coalition. The Healthy Farms, Healthy People Coalition is a coalition of agriculture and health interest groups working together to find common ground for policy shifts at the local, state, and national levels for the near and the long term. Such shifts that will support healthy farms as well as community and individual well-being. Both IATP and the Center for a Livable Future are on the steering committee for the Healthy Farms, Healthy People Coalition. And I believe the website is listed there on the resource page for you there at the bottom. A recording of this webinar will be made available next week at healthyfoodaction.org. And another resource for those interested in health that is not listed here, but feel free to contact us at the Center for a Livable Future about, is the American Public Health Association's Food and Environment Working Group. So that's public health professionals who are working on food system issues. So again, I'd like to thank Jennifer Billig, Roni Neff, and Beth Hoffman for speaking today, and especially thanks to all of you for joining us.